When will I start to see lens replacement treatment results? Following lens replacement surgery, there is a healing process, and there's a time during which the vision needs to adapt to the new vision. So the natural lens of the eye has been replaced and an artificial lens has been inserted. So it takes time for the brain to adapt to that. There are two solutions for refractive lens surgery. One is to use a multifocal lens, and the other is to use so-called monovision, the dominant eye being corrected for distance and the non-dominant eye being corrected for near. Both require a visual adaptive process. In other words, the brain getting used to it. So patients are used to the fact that when they first wore varifocals, it took them a while to get used to them. In the same way, it takes time to get used to the new vision that either a multifocal or varifocal lens or monovision will take. Initially after surgery, within 48 hours, patients see a significant improvement. But it is a good to 6 to 8 weeks, in my experience, for all patients to fully achieve the final outcome, and occasionally longer. And many patients that I see a week after surgery will say, "It's much better, Mr. Morris, but it's not quite there." And I reassure them that it's early in the healing process. They're still using the drops. So patients use drops for a month after surgery, and while they're still on the drops, one wouldn't expect them to have made a full recovery. An analogy is if you've had a hip replacement or a knee replacement, a week after surgery you're not running around. It takes time for you to regain your mobility. And patients can understand that, I think, a little bit more easily than the fact that your eyes need to rehabilitate as well. Because the surgery is painless, because the eyes are not uncomfortable or painful afterwards, they expect the vision to recover at the same rate. If you have a knee or a hip done, it's painful afterwards. So because there's pain, you know it's not functioning well. So it is important, and we try and educate patients that it will take time for them to get the full benefits of surgery.